Hello, and welcome to this edition of Cal Parents Facebook Live. Today, our guest is Cal University Health Services Medical Director, Anna Hart, and our Student Health Insurance Programs Manager, Bahar Nawab. We're very excited for that. My name is David Ortega, and I'm the Director of Cal Parents Services and Communications. Very excited to be here tonight. This is a great opportunity for us to get University Health Services on Facebook Live. And we just want to make sure you guys remember that Cal Parents is your resource, central resource for all communications and all the support and all of your engagement with the campus. We also serve as an opportunity for you to volunteer with the Cal Parents Ambassadors Program. And also if you feel like you would like to philanthropically donate and support UC Berkeley, we would love to have you with us through the Cal Parents Fund. Next, we'd also love to have you be a part of our website, which is calparents.berkeley.edu, and our Facebook page at Cal Parents Berkeley. Okay, so this showcase is going to be for you parents to ask questions of all of our University Health Services administration. So please, it's a live conversation, so send in your questions as quickly and as honest as you'd like to have them read, and we might be able to try to get them online for you. Okay, so today we're happy to have Anna Hart, who came to Berkeley in 2001 and has been the Associate Director since 2011 to 2016, and now she's our Director of Medical Services for the University Health Services. With that, Anna Hart.
Thank you, Joseph. So I've been asked to say a few words about myself. I grew up in the UC system. I spent time on campus at Berkeley when I was a kid doing the music programs, and then I studied at UC Santa Cruz and UC Berkeley as an undergrad. I escaped for a little while and ran off to Yale for medical training, and then I came back to do my residency training at UCSF in primary care internal medicine, which is really a general medicine field that focuses on the care of adults defined as what we think it means. So adults going down to younger as well as older adults. But I really found that I enjoyed taking care of adolescent and young adults because of their vivacity and intelligence and interest and capacity to really absorb the information that we give them and run with it to make changes that really can set them up for success in their life as well as in their studies right now. So I came here. I do have a little side interest, which is infectious disease. So I've been doing that along the way. But otherwise, I've been providing primary and urgent care here for a long time. And with time, I took on more of a leadership role, which I also enjoy because it helps us work together to develop new programs. We've been doing a lot of that in the last few years, and we're doing that moving forward. I thought I should just define that the medical director at UC Berkeley University Health Services supervises and cares for everything under medical, but not under counseling and psychological services. That being said, obviously I spend a lot of time speaking with and meeting with people in that leadership, and I will do my best to try to answer any questions in those areas as well. There are also a number of other programs such as health promotion, social services, and a whole slew of other things going on at the Tank Center beyond medical care. So I thought we would start with just saying a little bit about care at the Tank Center. So all registered students at UC Berkeley can use the Tank Center, and we really love to have them access our care. It doesn't matter what their insurance is. We do have, as you know, an insurance plan, but the co-pays for basic care and primary and urgent care are the same for all students, as is access to mental health services through counseling. We do everything from very occasional brief visits to full service comprehensive primary care. We love caring for complicated medical conditions as well as minor injuries and things that happen here and there along their path at UC Berkeley. And we work very closely with all the other departments. So we have primary care, we have urgent care, which is really like a soft emergency room. We have advice nurse available all the time. We also have health and wellness educators, counselors, psychiatrists, social services, as mentioned. We have an in-house lab, pharmacy, radiology. I'm sure I'm forgetting a few things. Physical therapy. Really, 90% of students' needs can be taken care of at the Tank Center. And then we also spend some energy thinking ahead to what can we do to reach out to students before they actually come in terms of programs on campus, groups, communications, and so forth. So we manage the care all the way from the new undergrads who maybe never left the home before, or maybe have never accessed care or have had trouble with their insurance in the past, to graduate students with families or with disabilities. So I will go ahead and read the first question now. From Ted in Ladera Ranch, there's a question: how do students access care at the student health center, and how does it work if you don't have SHIP? So I started talking about that. There's a number of ways you can access care. The first thing to do, if you haven't done so already, or if your students haven't done so already, is to look at the website. We put a lot of energy into making it clear all the ways that you can access care. Not only do we have information about things that are going on currently, but it's also one way you can access our portal. And we have an E10 portal that allows students to connect with us without even coming in. And for many students, that's a lot more convenient. They can do everything from make appointments to send messages to our advice nurse, send messages to their primary care clinician, to ordering medications, to ordering some self-directed tests such as sexually transmissible disease or pregnancy tests. They can get contraceptives, and of course we'll advise them if we feel they need to come in. All students, when they register here, are assigned a primary care clinician with us. We do have a medical home model, so for those students who like to really establish care, who may have more complicated needs or just really value a relationship with one provider, we have a team set up to support that, and we really like it when people see the same person every time. It makes it a lot easier and more pleasant for them as well as for us. But of course, if people that doesn't work, they can come in other ways too, and they can walk into urgent care if they have a really urgent medical need as well. We have after hours access in terms of advice nurse. All that information is on the website. And we're actually open 7 days a week nowadays, which changed a few years ago. Our primary care is open just Monday through Friday, but during the academic year, our urgent care is open Saturdays and Sundays as well, which has been a real boon for students who get sick and don't seem to find the time to come in, and unfortunately sometimes get too sick and then come in on the weekend. So that's been working well too. We do operate predominantly on a same-day access model, which means that students can generally be seen within 24 hours of wanting to come in. So I have another question here from Kim in Albany. My son has a chronic medical issue. How do you work with families managing issues like this? So we have on staff a number of physicians. I can't quite keep track. I think it's something like 15 to 20 career physicians, as well as an additional 10 nurse practitioners. The physicians and the nurse practitioners are more than capable of managing chronic medical care. They come from a mixture of trainings, including family practice, internal medicine, women's health. And they do consult with each other when there's something that is outside of their scope of practice. My general suggestion would be that the student should make an appointment to be seen and to bring in their records or have them sent in advance so that we have a sense for their past medical history. And then once they come in, we'll work out a plan to make sure they can access the care they need, whether we can manage it all at the Tank Center or whether we need to refer them out to the community if we do not have that available. Regardless, we can certainly continue being their primary care clinician and team while they are a student here. If there's a student where they're first starting at Cal and perhaps the parent wants to alert us to a complicated situation in advance to help prepare the way for them, they're more than welcome to reach out to us and can do that in a number of ways. You can do it by mail, you can do it by email to tell Tang, you can call us, and we'll connect you with a care manager or nurse who can help facilitate making sure that we're ready for your student when they arrive. But of course that can happen at any time as well. For privacy reasons, we can't share information back about the student once they're under our care, but we are always here to listen, and we'll work very closely with you to make sure that they are safe and well cared for. So I'm going to go to the next question from Steve in Dana Point. I see so much on the news about mental health struggles in college. How do you help students at Berkeley? So I'm going to pull up my cheat sheet a little bit here because, as mentioned, I don't supervise that, and I wanted to make sure I'd cover everything. I will start by saying that we do have in-house counseling, psychiatry, social services, and health promotion, and that we are absolutely here and ready for any student who needs triage to be figured out what they need. What does that mean? It means that we offer individual counseling, couples counseling, career counseling, groups, workshops, etc. We have urgent walk-in for critical needs. We have also an on-call service for things that happen over the weekend. And we can facilitate students getting care within the Tang Center if they have a brief need, or referring them out to the community if it turns out they actually have something that will need more long-term therapy or care. And the reason for that is we have 40,000 students at Cal, and we want to make sure we are able to care for everybody. And most students really only need a couple of visits to help figure out what they need, or even complete treatment. We're very used to doing a brief intervention model. That being said, if things need to escalate to psychiatry or to the community or to an outside mental health hospitalization program or such, we certainly have mechanisms in place to coordinate that care. We also have a number of wellness and prevention strategies happening on campus with outreach. There are 10 plus satellite clinics on campus for casual drop-in for students who perhaps aren't ready to seek care at the Tang Center, whether it's because of stigma or their schedule or convenience, and they can just drop into those centers on campus for brief counseling. And then we're also right in the middle right now of a project to actually integrate behavioral health care right into our medical services and primary care, so that if students come in even about a completely unrelated issue, a sprained ankle or sore throat, but it turns out they're suffering with stress from exams or something more serious, we'll be able to spend a few minutes with them right then with a trained mental health professional to just support them and figure out if we can help them right in the moment. So that's very exciting. That'll be coming within the next year, hopefully this fall, and there'll be more information on the website then. Finally, as mentioned, we have psychiatry. The primary care clinicians can really manage a lot of mental health, as is the case in the community. But when cases are more complicated, we definitely both refer to and consult with our psychiatry colleagues. And lastly, I have been reminded that it's important to understand that mental health issues at Cal are no different from mental health issues elsewhere in the country. We are really seeing a national surge in the amount of demand for mental health services in the country, and we're all working very, very hard to keep up with that demand. And are working hard also to educate faculty and staff on campus, as well as fellow students, to be able to early recognize signs of mental health distress. So I have a question here from Teresa from Moraga. Cal Central has a delegate system in which a student can give authorization for grades and finances. Does Tang offer the same type of authorization for health issues? I'm guessing here a little. I think that might mean that has to do with, well, can the parent then be somebody who can give authorization for health care? So we obviously respect the privacy of our students. We are subject to a number of federal laws around this, including one called HIPAA, which you may have heard of, but also another one called FERPA, which governs the laws around privacy for release of students' information, which means that we cannot release information to a parent or anybody else without the student's express release, signed release. Now, there are some exceptions for absolute emergencies. Certainly, again, we try very hard to make sure that we are available to hear the concerns of any parents who can even call and speak to one of us, even though we will not tell you anything without the student's release. We will listen, and it may inform what we can do. So I understand very much, I'm a parent myself, that it's frustrating and scary to not be able to take on the responsibility of managing the care for your student. But if they are an emancipated minor, 18 years or older, we have to follow these laws. And I think Bahar may comment on that later as well. So I will also say we do on occasion, when somebody comes in and they're sick and we anticipate that it'd be really good to involve the family, we certainly take on a role of recommending that to the student, really strongly suggesting that we find a way to involve the family or anyone else who's close to them. We can facilitate joint case conferences. We can facilitate phone calls with the family on the line if the student is willing. We can do a number of things to include the people who support the student in their care. with their release again. And we will certainly recommend it when we think it is clinically appropriate while respecting the student's right to choose and manage their own health. And we spend a lot of time as health educators really trying to empower students to learn how to best manage their health. That's one of the fun things about this job. We're not just dealing with crises, but we can help teach people how to look after themselves and how and when to access health care. Sometimes we have people coming in for a cold for a day, and we actually don't mind that. We'd like to have them not have to come all the way in. We'd like them to stay home and rest, but if they made it in, we'll spend our time then teaching them how to look after themselves better. So I have a question here from Frank from Denver. What are the typical issues that students come into the Ting Center? So this is a good one. I do all the hiring for the new clinicians, and I've noticed that people seem to think that student health is all, sex, sprained ankles, sore throats. It's not. There's a lot of it, absolutely. We see a lot of little minor injuries to more severe injuries, sprains and strains. We certainly see a lot of items related to sexual health, whether it's STIs or routine preventive care or gender orientation concerns or anything else in that arena. We do see some pregnancies. We certainly see a lot of mild or more severe respiratory illnesses, from the cold to the flu to some pneumonia. But then we also see more significant issues, things that people would go to the ER for usually, and we can actually manage most of them. So we see appendicitis, we see really bad asthma, we see really interesting travel diseases because the students seem to do a lot of fun things on their vacations. And then, of course, we see chronic illness as well, diabetes and high blood pressure, and people who are disabled who need care, and an awful lot of mental health, again, to come back to that. It permeates many of the visits that come in just because of the nature of academic stress, and sometimes more severe, since this age group is one where sometimes more significant mental health disorders like schizophrenia can present. So we see plenty of complicated illness, but we also see a lot of mild things that we can either treat ourselves or, to be honest, help students treat themselves and prevent them happening again. So I see a question here from Nick from Indo. How do you get feedback on the Ting Center? How do we get feedback? Well, first of all, if you haven't spent time on our website, you should. If you want to give us feedback, then there is a Tell-Tang email address. I believe it's telltang@berkeley.edu, which is monitored constantly, where anything that comes in, of course, is passed on to the right people. The students themselves can also, there's comment slips all over the building. We also solicit feedback from students actively all the time, both through some student groups, the Student Health Advisory Committee and others, and through surveys of our students who have accessed care. And we look at that pretty much continuously to try to improve our services as well. If we get a complaint or concern, we make every effort to reach out to that student. If we get a complaint or concern from his parent, we make every effort to reach out to the parent, again with a caveat that we cannot discuss specifics without a release. So we definitely want to hear about it if things are not going well. Of course, we like to hear about it when things go well as well, because our providers work very hard to make things work. So I hope this has been helpful. I'm going to wrap it up and introduce my colleague, Bahar Nawab, who is our Student Health Insurance Manager, and I'll let her say a few words about her background. Thanks, Bahar.
Hi, Cal parents. I'm Bahar Nawab. I'm the Health Information and Insurance Manager here at University Health Services. I actually got my start at Berkeley. I did my undergraduate degree here and grad school in health policy. I've been involved with the Ting Center as a student for a number of years, actually on some of those committees that give feedback, Health Advisory Committee and a number of other projects with the Health Center. And so eventually it just made sense, having a background in health policy, to get involved with the health insurance side, and I've been the health insurance manager since 2015. I'm really excited to talk to you all about insurance, in particular because I've been a student on the SHIP plan, and so I see it from both perspectives. What you may not be aware of is that there's a Regental mandate. The condition of enrollment is that your student has to have comprehensive health insurance. And so we offer the student health insurance plan as a way to meet that mandate. So all students are automatically enrolled in SHIP, but we do give families the option to waive out if they have a plan that meets the insurance criteria that the university requires. So let me start first with what is SHIP. The Berkeley Health Insurance Plan, Student Health Insurance Plan, includes comprehensive vision, dental, medical, and mental health coverage. Our carriers are Anthem Blue Cross, MetLife, and VSP or Vision Services Plan. Our plan is year-round, so even when your students aren't at Cal, the plan still follows them. We start August 1, and we go through the plan year, so through the academic year to July 31st. And there's some key other dates that you should be aware of. If you do want to waive out, the waiver period opens in May, and it goes through July 15th without any late fees, or through August 15th with $50 late fee. Your students can have dual insurance. If you want to keep your insurance back home but want to take SHIP too, we encourage you to do that. SHIP will be primary for most of our students, and if you have questions about coordinating your care, you're welcome to call our offices or email us, and we'd be happy to answer your questions. And if your student ever loses their insurance, whether it's due to changes in Washington or changes to your employment status or whatever it may be, students can always come back on to SHIP at any point in the year. We also allow waivers in the spring. If you miss the fall waiver period, we have another waiver period that goes December through mid-January where your students can waive again. So I'm going to take questions actually because we only have a few minutes, but Mary from Rialto asks, why is the SHIP premium so expensive? That's a great question, and it may seem expensive, but it's competitive and comparable to other plans like it on the market. And the other thing is that we've really strived to keep costs low at the point of service. So co-pays and deductibles when students are going in for care, we really want to make sure that they don't feel that cost is a barrier to them seeking care when they need it. And again, keep in mind that it's comprehensive, medical, mental health, vision, and dental, and that we're responding to particular pressures in the Bay Area. There's a very expensive Northern California market where we have a few big providers that have a monopoly, and we have to respond to that. Additionally, there are schools that don't allow families to waive out, so everybody's in the plan, and that keeps the pool big and keeps the cost low. So we might seem expensive compared to some other schools, but we do have the benefit of waiving out of our plan if you choose to do so. Another question from Nausicaa from West Hollywood. How do you communicate to students about the waiver? So we do a number of things. We communicate both with students and with parents, actually. We, to date, have had a great presence at CALSA, which is the orientation for incoming students. We do a session with our medical directors there and answer questions live for families. We also send out 3 emails to students throughout the year, not the summer, I should say. We send a postcard to the parents' permanent address or wherever the students have listed as their permanent address. We also advertise with Cal Parents and on Facebook and social media, and we coordinate with our student governments to make sure that we're sending communications out. If you're interested in learning about the waiver, you can go to our website, which is uhs.berkeley.edu/SHIP, and you can read all about the waiver criteria. We already have the criteria posted for next year. Please do keep in mind that the waiver process is an annual process, so the criteria might change every year, and so it may seem cumbersome to have to do it every year, but we do encourage you to go on and take a look as they change. And also, just a little bit more about SHIP. This is a PPO plan, so it covers our students throughout the country and in fact internationally as well. So if your student is traveling abroad, they do coordinate their care while they're abroad. We also offer evacuation should there be an emergency where your student is, whether it's natural emergency or political emergency. And if your student is home for the summer or winter break, the plan covers them no matter where they are in the country. We do have a network, and we do provide referrals for students to get care wherever they might be. We have another question from Asha from San Jose. What happens if Obamacare is repealed? This is a very timely question. So There's a couple things that are probably what's on people's mind. SHIP will not be impacted by the Obamacare repeal or the ACA repeal when SHIP happen. We offer comprehensive benefits, and we've offered them before the ACA existed. We were ahead of the curve, and so we'll continue to offer those benefits even if the ACA is repealed. We do have the benefit of designing our plan, tailoring it to our student population so that we can respond to their needs. So we don't anticipate there to be any direct impact on us. We have already set the plan for next plan year, as well as prices for the next plan year, and we don't anticipate any changes there. And should students lose their coverage because they were on an exchange plan or a marketplace plan that disappeared with the repeal of Obamacare, then they have the benefit of coming back onto SHIP at any point in the year. So we don't anticipate there being a lot of impact for us directly if there is an ACA repeal. I think there's another question coming. What happens if a parent of a student who waived out of SHIP then loses their job and doesn't have insurance and not sure if they can pay for it? So if a student loses their insurance, they can always contact our office, and again, they can come back on the SHIP at any point in the year. We also work really closely with our partners over at Financial Aid to see if we can give you any resources to help pay for SHIP. An important thing to note is that Financial Aid doesn't always package automatically for SHIP, and so we encourage you to call Financial Aid and ask them about SHIP in particular and say, hey, I'm not going to waive out, I'm going to stay on SHIP. Can you tell me if I can be covered for SHIP? And they will take a look, and they will package your insurance, or package your financial aid, I should say, to cover you for SHIP. So, and again, if you're not sure, please call us. If you have questions about coordinating care between Medi-Cal and SHIP, or your home insurance and SHIP, we're happy to do that. Our office also handles any claims issues that students might have while they're at Berkeley. We're happy to help if there's a problem with coverage, or if there's questions about a particular condition your student has and you want to know what the cost of care might be, or prescriptions might be. We're also happy to help you answer those questions. So feel free to contact our office. Our email is ship@berkeley.edu, and our phone number is 510-642-5700. And parents, feel free to call us. I should mention my other role at UHS, University Health Services, is the health information side. And so there's a question about how do you access your students' health information or get information about their insurance or billing and things like that. And there's a couple different things you can do. We have something called an eTang portal. It's like the Cal Central portal that you might be familiar with. It's a portal that students can log into and access some of their health information. They can email their providers, they can get their lab results, and one of the things they can do on that portal is to fill out a release of information. And so they can say, I allow you to talk to my parents about the billing records or my insurance records, and or to get information about a lab result, and they can limit it to whatever it is that they are interested in sharing with you, or it can be broad, and they can say it's consent to speak to my parents or to physically give them copies of my medical record. And that's also where your students can submit immunization records and things like that, and also see, again, lab results and insurance information as well. So we encourage you to do that. But also, I'm happy to talk with parents if you have questions about the waiver, about your insurance in particular. Our offices are available to talk to you, so we encourage you to call us. And yeah, I think that we are wrapping up, and thank you so much for hosting us today, Cal Parents. And again, as a former student and staff member here, I'm excited to work with your students and to work with you, so go Bears.